Bronchitis and sinus infections are two common ailments that affect the respiratory system, each targeting different areas but sometimes causing similar symptoms. Bronchitis is characterized by the inflammation of the bronchial tubes, leading to coughing, phlegm production, and difficulty breathing, while sinus infections, or sinusitis, often present with a stuffy nose, facial pain, and pressure around the sinuses. Treatment for bronchitis may include rest, increased fluid intake, and medications like bronchodilators or anti-inflammatories, whereas sinus infections might require nasal decongestants, saline sprays, or antibiotics if a bacterial infection is present. Smoking is a significant risk factor for bronchitis, while factors like allergies, nasal polyps, or a deviated septum can increase the risk of sinus infections. Understanding the differences in symptoms, treatment, and risk factors is crucial for proper management of these conditions. Here's a more detailed look at the intricate aspects of bronchitis and sinus infections. Location of infection: lower respiratory tract versus upper respiratory tract. Bronchitis and sinus infections, while both respiratory ailments differ in their infection locales. Bronchitis strikes the lower respiratory system, predominantly affecting the bronchial tubes that carry air to the lungs. It's often signified by a deep hacking cough, production of mucus, and can be chronic or acute. On the flip side, sinus infections, or sinusitis, target the upper respiratory tract, specifically the sinus cavities nestled around the nasal passages. Symptoms include facial pain, pressure, nasal congestion, and discharge, often with a fever. Recognizing the infection's domain helps practitioners tailor treatments: bronchodilators for bronchitis and decongestants or antibiotics for sinus infections. Type of symptoms: cough and chest discomfort versus nasal congestion and facial pain. Bronchitis and sinus infections, while both impacting the respiratory system, exhibit distinct symptoms that help in differential diagnosis. Bronchitis typically presents with a productive cough, which can be accompanied by chest discomfort and wheezing, as the inflammation is primarily in the bronchial tubes. Conversely, a sinus infection is often indicated by nasal congestion, postnasal drip, and pain or pressure in the facial region, particularly around the sinuses. This discomfort can sometimes be exacerbated by bending over or lying down. Understanding the nuances of these symptoms is crucial for healthcare providers to diagnose accurately and prescribe an appropriate treatment plan. Nature of cough: productive cough versus cough due to postnasal drip. When distinguishing between bronchitis and sinus infections based on cough characteristics, productive cough is commonly observed in bronchitis. Patients with bronchitis generally expectorate sputum that can be clear, yellow, or green, signaling an inflammation or infection of the bronchial tubes. In contrast, a cough associated with a sinus infection is primarily due to postnasal drip. The sinusitis-driven postnasal drip irritates the throat and can trigger a cough, which tends to worsen at night or while lying down. This is because the mucus from the sinuses drains into the back of the throat, leading to coughing spells aimed at clearing the irritation. Predisposing factors: smoking and air pollution versus allergies and nasal polyps. Predisposing factors in illnesses like bronchitis and sinus infections play a crucial role in their occurrence and management. In bronchitis, smoking stands out as a key contributor, directly irritating the bronchial tubes and perpetuating inflammation, mucus production, and coughing. Air pollution exacerbates these effects, adding environmental insults to the already compromised airways. Conversely, sinus infections are often triggered by allergies, where the immune system's overreaction to harmless substances leads to nasal congestion and sinus passage inflammation. The presence of nasal polyps, non-cancerous growths, can further obstruct drainage, creating a breeding ground for infection. These distinctions offer vital insights for prevention strategies and targeted treatments, tailoring interventions to address the unique vulnerabilities of each condition. Typical duration: several weeks versus up to 4 weeks. Bronchitis and sinus infections, while presenting with similar respiratory symptoms, have notably distinct courses in terms of duration. Acute bronchitis usually resolves within several weeks. Patients experience a cough, often productive with sputum, alongside potential wheezing and shortness of breath. On the other hand, sinus infections, sinusitis, can linger up to 4 weeks, causing symptoms like facial pain, pressure, nasal congestion, and purulent nasal discharge. Chronic cases may persist even longer. Correctly distinguishing between these conditions is crucial since it impacts the management approach. Bronchitis often requires supportive care, whereas sinus infections might benefit from targeted antimicrobial therapy in bacterial cases.